Here is a case where URSL is done with Thulium fiber laser. While junior consultant was doing, I was guiding. Lot of discussion nowadays is happening about Thulium fiber or holmium laser causing strictures in ureter. Every case is important. This is one of the easiest case where you can use pneumatic or else laser. But pneumatic sometimes stone may migrate into the kidney. From the lower ureter, migration is unlikely. In such case, pneumatic lithotripter is the first choice. By chance, if you wanted to use the laser, how it should be done for the junior most consultant, when he was doing, we recorded. I thought in this short 3 minutes video, the next generation who uses lasers must take care like this. Here is a case of lower ureteric stone and non-stented VUJ calculus of only 8 to 9 mm. The entry of the ureter is always done with the 6 by 7.5 ureteroscope. If it does not go, 4 by 6.5 ureteroscope is also very good scope. See here, the surgeon has to turn towards the 3 o'clock the ureteroscope and then enter in the first to go. Like see here, it is turning 3 o'clock and then turning back to 12 o'clock. So now when we go inside, when you see the stone for a beginner, leave the guide wire and re-go inside. This is the first step. There are a lot of advantages. With this guide wire in situ, the stone doesn't go up. Here, when you are using laser, use in pulses. Don't use continuously when the vision is not there. Press the pedal, leave it. Press the pedal, leave it. The setting here is lowest. What is the lowest? 6 Hz and 1 joule fragmentation mode. Still low can be better. Now once it is made into 4-5 fragments, when you go inside, try to cross the stone and go a little up into the normal ureter and then empty the kidney and reduce the hydronephrosis, because this is hydronephrotic kidney because stone is impacted. Now when you are removing the stone, one more thing we observe, it gets pieces. That is a good sign, there is no problem. Now when you are taking out the fragments, the trick is go on to the floor, rotate, keep rotating, floor. 6 o'clock you touch and then remove like this. Then avulsion will not happen. Each fragment, how to assess the size is, it should be lesser than the luminal size when the ureteroscope is kept at 1 to 2 millimeter distance. One guide wire is helping multiple entry into the ureter. And these stones, when you are removing, some amount of difficulty will be there. That can be avoided by using the circle basket also, which entrap. But the only problem is if you encircle large fragments, it may be get stuck in the ureter. So tri-prong forceps as well as the basket both must be used cautiously for a smaller fragment than the ureter lumen. So making fragmentation with the laser intermittent usage without losing the vision is the secret, not touch the any part of the wall. Even sometimes if the laser is not touching any part of wall, heat can be transmitted. That can be avoided by reducing the frequency and energy and using only for fragmentation and not using for a large impacted stone. Large impacted stone, pneumatic lithotripter is the best. Even if the stone is in the upper ureter and goes into the kidney, it is still better to pass a stent, come after 12 days, go and do RIRS, very safe for the patient. This is a message in this video. Thank you.